me. I am pleased to be joined today by Matt Yarnell with SEIU Healthcare PA, and also Michelle Kessler with the UFCW, an old-time friend. And these are folks that it's their business to stick up for the rights of working people across our Commonwealth. I also want to welcome Leslie Dack, the chair of Protect Our Care, whose organization has been doing critically important work fighting for affordable care for all Americans. Look, right now we're in the middle of this pandemic crisis, and we have millions of Americans across our country being ordered not to work, to shelter in place. Essential workers at the same time are doing the exact opposite, and that includes frontline healthcare workers coming into close contact with known COVID-19 patients. So that includes essential workers, grocery store workers, people keeping us eating, keeping us alive, basically, and in many instances doing it for not a whole lot of money. Every day, grocery store, mail delivery, healthcare, distribution center employees continue to report for duty in order to provide our communities with life-sustaining services during this crisis. And here's the thing: every day they show up for work, and there's this sense of inequity that all of us feel, that so many Americans are being told to stay home, or being paid to stay home, and out of harm's way. At the same time, we have these essential workers and these frontline healthcare workers going to work every day, making the same pay that they've been making, working for it, and at the same time exposing themselves to danger, exposing themselves to the risk of contracting COVID-19 disease, and also exposing their families, because they're going home to people who could be infected. So everyone feels that these people are out there giving their all for us, making us safe, keeping us alive, and there's an inequity in all of that, and all of us feel it. Earlier this month, I held a listening session with state and local labor leaders in an effort better to understand the hazards facing essential workers and to identify strategies to support them. As a result of that call, I huddled up with my legislative staff, and I authored a resolution expressing Congress's support for the provision of PPE, personal protective equipment, health insurance, and hazard pay to warehouse distribution and delivery workers. But today what we're talking about is hazard pay. And the fact is, too many workers who have neither health insurance nor a living wage are being asked to put their lives on the line to keep our nation afloat. They deserve a pay that reflects not only the work that they're doing, but the danger that they're encountering. That's why today I am unveiling the Coronavirus Frontline Workers Fair Pay Act. Coronavirus Frontline Workers Fair Pay Act. It's a bill that would authorize an additional $13 per hour in hazard pay, up to a maximum of $25,000. And for our frontline healthcare workers who are every day in these trenches, getting up close and personal with known COVID victims, dealing with this invisible enemy right at patients' bedsides, this bill would provide an increased benefit of $18.50 an hour, up to a maximum of $35,000. Now, the bill provides that this hazard pay would be retroactive to January 31st and would be available through the end of 2020. This is all funded by a separate bucket of money in the U.S. Treasury to recognize the efforts and the expended by these people and the danger that they're undergoing in support and defense of our population in this country. There's just a lot that needs to be done for our essential workers, but securing hazard pay for those in harm's way and out there doing their job every day to keep us safe, it's the least we can do. I am proud to lead my colleagues in the House in fighting for hazard pay for these workers, and I'm going to continue to be a champion for these workers that we owe so much to as we go through this pandemic crisis. So with that, I want to turn it over to Leslie Dack to say a few words now. Leslie, take it away.
Great. Thank you. My name is Leslie Dack, as the Congressman mentioned, and I'm the chair of Protect Our Care. And I want to start by commending the Congressman for his leadership on the issue in front of us today, but overall for his leadership in both standing up for workers and standing up for healthcare in America. He fights that fight every day for Pennsylvania, for the constituents of his district in Washington and at home. So thank you for that. The bill that he is introducing today is so important. Our frontline healthcare workers who work in hospitals, who work in nursing homes, who work in clinics, and our essential workers who stock the shelves and check us out at the grocery store and deliver those goods and deliver our mail, they deserve a fair, equitable, and living wage for what they do. And that isn't what's happening here today. As the Congressman said, they're risking their health, they're risking their lives to be on the front lines for the rest of us so that we can lead our lives with some emotional stability, some greater degree of safety. And it's great that they're being saluted and recognized, but they also need to be paid. And that's what we're here to talk about today. And not only do they need to be paid, but frankly, they also need the kind of health care and health insurance and coverage they deserve. Well, the president likes to say that we're fighting a war, but it's really, as the Congressman said, these workers who Matt and Michelle represent and who the Congressman represents, they're the ones who are waking up every day and suiting up and fighting that war on behalf of all of us. So we fully support these efforts that the Congressman, backed by labor and others, are introducing and will fight for today. And as I mentioned, these workers and millions just like them deserve quality, affordable health care. Those who lost their jobs and those who never had employer insurance because they worked part-time or worked for an employer who simply wouldn't give it to them. They deserve the opportunity to be able to go purchase affordable health care on the ACA exchanges, but this administration refuses to allow the uninsured that opportunity. And those who are lost their insurance deserve to understand and to be informed about the opportunities that do exist for them on the Affordable Care Act exchanges. But once again, this administration has simply refused to spend a dime on educating those workers who've lost their insurance about the opportunities that are available to them. Instead, all they do is being willing to add a page or a sentence to a website. It's unconscionable. As Congress completes its attention on the bill that will be voted on this week and moves to the next COVID response bill, we hope that if not before, then certainly then, this bill that Congressman Cartwright is talking about today will be eventually a part of that package because it's so essential. And that package also include a special enrollment for people who are uninsured, that it includes marketing dollars so that people who've lost their employer coverage know they can get it from the Affordable Care Act, that it strengthens provisions for pre-existing conditions. We're going to see millions more Americans have a pre-existing condition as a result of this epidemic, and yet the administration insists on taking those pre-existing conditions away from them by going into court and overturning the entire Affordable Care Act. And the administration also insists on, through this lawsuit, of stripping health care from 20 million more Americans on top of those who've lost it already. So Congress is doing the right thing, and we hope to, Democrats in Congress leading the way, we hope there'll be a lot of Republicans supporting them. But we at Protect Our Care, along with our colleagues, will be working very hard for this bill and working hard for the other provisions that I mentioned. And I want to conclude once again by thanking the Congressman for his leadership, but also to recognize and thank Matt and Michelle for all they do every day and for what SEIU and UFCW do every day to keep America working and to keep America's workers treated fairly. Thanks for giving me a chance to participate today. Thank you.
Thank you, Leslie. Mr. Yarnell.
Great. Well, I just want to start by really appreciating Congressman Cartwright's leadership here. For those of you who don't know me, I'm Matt Yarnell, I'm president of SEIU Healthcare Pennsylvania, and we bring together about 45,000 healthcare workers across the state of Pennsylvania. Those are Commonwealth professional registered nurses. Those are registered nurses in acute care hospitals. They're also nursing home workers, other hospital workers, and home care workers. And so I couldn't be more proud to see this legislation be unveiled today. I think it's absolutely the right thing in the right moment. We as a union have been fighting for access to quality, affordable healthcare for as long as we've been around. You know, I think that any one of our members would tell you that our the U.S. healthcare system and delivery system was pretty broken before you put a pandemic on top of it. So I just think, given the moment, given this pandemic, it's going to take, you know, really an act like this to have the backs of workers who are thrust into some of the most challenging situations they've been in their careers. And I don't think, you know, I was talking to somebody earlier today and they said, well, are people leaving the bedside because of this? I said, well, actually, people were leaving the bedside ahead of this pandemic because of the challenges in our healthcare system. And I would say people are leaning in this moment, but they need to be assured that if they get sick, they're going to have access to care and a ventilator if they need it. They need to be assured that they are paid a living wage and paid, frankly, essential worker pay and hazard pay in this moment to keep people on the jobs and make sure that we have our arms around the people who are going to save us from this pandemic. And I would just say we've been fighting as a union for PPE as well. We believe the administration has really failed here on having a national coordination of PPE and not taking this serious enough and not really using the full power of the federal government to have the backs of working people, not just healthcare workers on the front lines, but every single essential worker out there, including Michelle's members, everybody who's still working to sustain life in this country, need to have the proper PPE to be safe. You know, and I just think, you know, there's now a move, you know, I was just, a couple of our nurses and caregivers were on the street yesterday in a very small, socially distant counter protest in Harrisburg, you know, where people are, you know, pushing for a complete reopen of the economy, which I know will absolutely, which is, first of all, a public health hazard and will absolutely kill many people in this Commonwealth and also the caregivers and the other essential workers out there who we've been trying to socially distance and complete, you know, and try to mitigate spread in this moment. So I just would say I couldn't be more proud. I think Congressman Cartwright, this is right spot on, and we are going to do everything we can as the healthcare workers union, representing obviously union healthcare workers, but every healthcare worker in the Commonwealth to have your back and to push hard in Congress to do the right thing here. The people who need a bailout are the people who are going to save us from this pandemic, and I think this goes miles to shore up the workforce. Two things I'll say. We've, I know this is true for Michelle as well. I began my week last week with news of one of our you know, member leaders who was a certified nursing assistant in a nursing home in Reading who lost his life, middle-aged man, lost his life to COVID. You know, I read his family member's remarks and, you know, he died, he died by himself. And as a former nursing home worker myself, the one thing, given as challenging as things are for caregivers on a normal day, the one thing we always commit to as caregivers is to not let anyone die alone. And the stories of caregivers who end up dying alone are outrageous, and we should do everything to have their backs. And also the stories from caregivers talking about 7, 15 residents or patients dying on a shift. There's got to be deep impacts on these workers coming out on the other side of this. And we better do the right thing. We need moral leadership. We need leadership in this moment to have the backs of people who are doing one of the most important jobs you know, I think of our lifetimes in this moment. So the last thing I'll just close with briefly is I was at the counter protest yesterday, and a nursing home worker spoke to a news outlet, and I just want to read her quote because I think it speaks to what we're up against, and it's really talking about moral leadership. Her quote was, her name is Yetta Timothy. She's been a nurse aide for over 20 years. She said, "I'm sitting here and looking at signs saying open PA with no testing," she said, crying. "It's like they don't care about lives, people around them, or the people they love." And I just think that's, caregivers have huge hearts and we better have their back. So thank you so much, Congressman, and we're ready to do whatever it takes to move this forward for working people.
Thank you, Mr. Yarnell. Ms. Kessler, we'll go to you.
Good afternoon, everyone. I'm not quite sure how I could speak after you, Matt. That was very emotional to hear that. And I do want to thank Congressman Cartwright for being a champion for workers, not only on this hazard pay, essential worker pay, but even more importantly, and something our union has made our #1 priority is safety, getting the PPE to the workers. All this is, very important. I think this is critical that we pass this essential pay for on so many levels, but making sure the workers are safe in the first place. Our union across Pennsylvania represents about 35,000 workers, about 20,000 working in grocery stores, 8,000 in food processing and food facilities, 3,000 in retail pharmacy, and we also represent a few thousand in healthcare, just like Matt does, Matt Yarnell. These workers, the emotions that they go through every day before they step into their workplace is absolutely gut-wrenching. They understand the obligation that they have to take care of their fellow citizens, and they have taken on this burden in such a meaningful way. They worry about the customers who are coming into their store, hundreds of them a day passing by our workers in grocery stores, which is amazing. They worry about in our food processing plants. They work there with hundreds of other workers in so much small areas and possibly taking something home to their family. We had yesterday, one of our members from one of our meat processing facilities call her husband died, and she felt such guilt because she knew that that had to come from her. And at the same time, she felt, and all our members are feeling, this absolute obligation to feed our country, to keep our communities nourished, and in our healthcare facilities to take care of their fellow citizens. And making sure they're safe, making sure that they can do their jobs is very important, but also recognizing that the risk that they take. And I think throughout our history in this country, if you are working a job that you are particularly put at risk, it's recognized in how you're paid. And when these folks took jobs working in a grocery store, working, making food products, no one ever thought that each day that they went to work could be the day that they caught something that they would not ever recover from. And without question, this is a great bill in terms of recognizing these workers, not only our union workers who in many cases make significantly more money, who all have health insurance, but also taken care of in the non-union workplaces, where in the past few weeks we've received an enormous amount of calls of things that are going on. In our workplaces, we have union stewards, we have union representatives who bring issues to companies so we can try to correct them. But even in the most secure workplaces with temperature screenings, proper PPE, enforced social distancing, there's still risk. But there's many workers across the Commonwealth of Pennsylvania and across the US who don't have a voice in the workplace. So Matt Cartwright, thank you for what you're doing, and we stand with you every day. And I wish I could end with a quote like Matt Yarnell ended, but let me just say that I remember there's a term that I heard when I was a kid. I was a history major in college. A grateful nation thanks you. And I will say a grateful nation thanks you for stepping up for people. They want to know that someone has their backs, that they're not just out there doing this. They're not just out there doing this to make a paycheck every week, although they need that paycheck every week. They need their health care every week. They're doing this to take care of their fellow citizens. And it is so humbling to witness this every day. Again, thank you.
The southern reaches of Luzerne County have been horribly stricken by COVID-19, particularly around Hazleton and in Hazel Township, which rings Hazleton. It has a bunch of big warehouse facilities and some manufacturing facilities. A lot of people work there that live in Hazleton, and I was down there last week. I did a a live press conference with Mayor Jeff Cassatt, the mayor of Hazleton, who has ordered a curfew. It's so bad in Hazleton. At the time, the numbers were staggering. I think Luzerne County had about 1,000 COVID-19 infections, and something like 890 of them were right around Hazleton. And so something was happening there. And yeah, we've talked to some of the plant managers, but to me, the obvious thing was to get a set of eyes from the industrial hygiene discipline into the area. And so I called for an OSHA investigation of several of the plants there, and that's ongoing. It's when you don't provide PPE, when you don't allow for social distancing, some of these places, just the nature of their work, they can't do it. I mean, we've seen that across the country with food processing, meat packing plants. People end up working closely together. That's just the nature of the business. And we had one of those in Hazleton, and they had to shut down for a while. And the answer is yes. We're keeping our finger on it. Hazleton is in my district, and I'm working closely with the Republican mayor of Hazleton, Jeff Cassatt, who's equally concerned about the whole situation.
Could I add to that for just a second? Is that all right?
Oh, of course.
Yeah, I just listening. I mean, I think we've run into this problem in healthcare. Obviously, it's pretty hard to socially distance when you're working, in doing personal care on individuals, whether it be in a hospital or a nursing home or delivering care in someone's home as a home care aide. And I just think it speaks to the need to trust the voices of frontline workers, obviously healthcare workers. And I think also the science of this thing, because it's so contagious and because of community spread, it's really, really important that we don't rush to try to just reopen. Unless we don't care about people's lives. Honestly, I just think it really is important that we take that super serious. I can't stress it enough. I'm very worried about a push and the constant mixed messages, from our federal leadership on this. It's really pretty terrifying, frankly. And so for those of us who can stay home, and for those of us who can do our best to not spread, it's really important that we take that serious until there's enough PPE out there. And I think for Congressman's bill here to get money to the people who don't have that option, and frankly, to your point, Congressman, who don't really have the option to not be able to work in a community that's close knit, whether it be a meat packing plant or Amazon warehouse or a nursing home or a hospital. It's so important that we get the resources to them to understand that the work they're doing is really, really important, and that we do what we can to make sure that get them the supplies to stay as safe as possible in this moment. And there's just not enough. And there's been a total resistance from our federal government to use the Defensive Production Act to actually make what we need and get it in the hands of every single essential worker, obviously healthcare, but every other essential worker out there who's sustaining life. Until we have that, it would be really reckless to sort of turn the faucet on, in a very irresponsible way. So I just want to say that, because we're seeing it. We have hundreds of our members. We set up a hardship fund. Our board approved it to be able to give grants to folks. It's not a lot of money. It's $500. And already we have over 200 applications in. The thing was only announced not even a week ago. And that's 200 of our members who are experiencing a very real hardship because of either a COVID positive test or because of an inability to go to work because of a suspected quarantine. So it just couldn't be more serious that people really and employers in this moment. It gets so important that employers actually lean in a way that's non-defensive, that's transparent, that works directly with frontline workers to figure this out and triage through this pandemic. It's so important. The idea of being defensive or sort of hiding, outbreaks is just not going to work for anybody. I mean, we're all in this together. We hear that every single day, everywhere we go. And so one thing that means is people have to be transparent and be willing to be honest and in it with people on the front line.
All
If
right,
I
Matt,
could, I jump in there too?
yeah, go ahead. Let's try to keep it brief for our journalists on here.
Well, I think the only way to move forward and to open up this
All right,
country
Congressman.
again, at some point down the road, is OSHA's going to have really strict standards. It's going to have to be enforced everywhere, period. And everyone's got that PPE, period. And to ignore all these issues is absolutely delusional.
And is there any timeline on when any of this would be able to be brought up for discussion, possible vote, anything like that?
It won't be in this. We're talking about doing about a $350 billion supplement this week. The Senate could vote on it as early as later today. The House probably Thursday, maybe Friday. It won't be in that one. But we'll be pushing very hard to put it in CARES 2, and that's something we anticipate coming up in the first week of May. But if it doesn't make it into that one, remember, we are feeling our way through this crisis. We're on the job. We will continue to pass these bailout measures to bail out the American economy and the American public from this horrendous national pandemic issue.